everyone. Thank you for joining me once again on Olsem Wanem. In this special program this evening, we have a question and answer debate hosted by OSAID in partnership with MTV. And the focus is on access to quality medicine. Are they safe or not? Today's topic is a timely discussion on the quality of medicines available for the people of Papua New Guinea. The PNG health system is made up of approximately 2,700 health facilities, with the majority being located in rural and remote locations. Delivering medicines to these facilities is an enormous challenge in itself. However, ensuring that the medicines are good quality and will actually work is another challenge that is just as great and as important. Today, the global pharmaceutical market is being flooded with substandard and falsified medicines by unscrupulous manufacturers. This is a lucrative transitional problem that is estimated to be worth more than 400 million in West Africa alone. Substandard and falsified medicines lead to treatment failures, and there are many documented examples showing the deadly results. In countries such as Papua New Guinea, where drug regulatory oversight and health systems are strained, it is difficult to measure the negative impact of poor quality medicines. However, a scientific investigation published in 2011 provided direct evidence that substandard and falsified medicines are in circulation in Papua New Guinea. Anecdotal evidence shows that illegal medicine is available for purchase across the country. Therefore, the title of today's topic is Access to Quality Drugs. Are our pills safe?
Today's panel consists of Dr. Faisal Dakulala, Dr. James Kintwa, Dr. James Lau, Dr. Jane Thomason, the Honorable Sasindra Motala.
I'm going to say yes, but I need to pose the question, because what does right to access mean for quality assured medicine? So there's no debate about quality, but does that mean that every Papua New Guinean should be freely provided with every medicine available in the globe at a standard of quality? Or do these issues about affordability and access to care come into this for the poor? Do we fund drugs for the rich, or do we fund drugs only for the poor? Who provides them? Is it provided by the government, or can it be provided by anyone? So I think the question is, Papua New Guineans need to have access to a limited list of essential medicines provided by the government at an affordable price, depending on their ability to pay, but not necessarily free medicines for everyone in Papua New Guinea, and quality is undebatable.
Having access to quality medicines that is safe, effective, and acceptable quality, it's a basic human right. That right not only applies to Papua New Guineans, but the entire human race. And so that's an important statement that I'd like to make. But having said that, I would like to put in the statement that Dr. James Thompson has put in. And for us in Papua New Guinea, as you may have been made aware of, there is that priority that our government has put into bringing free health, free primary health care and subsidized specialist care. So there's a cost involved.
The answer is yes, because as a government, it's a government's responsibility to make sure that the citizens get quality assured medicines and also the enough quantity. But in reality, we are not sure whether we are getting quality assured medicine supplies, and also there is no enough quantity. Most of the times in the provinces, we experience lack of medical supplies. Like there is not enough medical supplies, even basic medicines like anti-malarial tablets, antiseptic medicines, even vital things like oxygen and all those things. We lose lives because of lack of basic medicines. That's the reality. But the answer to the question is, of course, yes, it's the government's responsibility to make sure that the citizens have the access to quality assured medicines. Thank you.
Look at all the aspects of drug supply and procurement. it starts from production up to actually making it available to the supply systems and to the point where somebody has access to it. We've got to make sure that the production is actually quality assured, and it's very important that the processes that are currently in place to acquiring drugs are actually answering that question, that are we getting the drugs from a place where it's quality assured. And I think with us we have WHO procurement process production, and I think they have standards. So we must make sure that the drugs that we are getting are actually produced from quality assured companies. That's where the production is. And when we get drugs into our country, I think so often we think that we are getting drugs that are quality assured, but the supply system and the storage system to a point where the drugs are actually made available to our people are also issues. Drugs can get sitting in vaults, for example, for a long time, and the storage and the supply system is also an issue. And we know in this country, I think that drugs do get to stay in vaults, they stay in containers, and so they lose some of that perhaps quality in the process. I think it's a dual, it's a negative and a positive as well. There are some drugs that are coming into the system that are actually quality assured, but I think there are some in the system that is not quality assured. When I'm saying that, I'm saying in the response from right from production up to actually storage and up to actually making it available to our public. Not only to the public system, but also the private system. People can actually go to a counter and actually access those drugs.
Quality assurance and testing of medicines is the responsibility of the Pharmaceutical Service Standards branch in the National Department of Health. And this is being tackled in the following ways. The National Department of Health has purchased 2 high-pressure liquid chromatography machines for routine drug testing in conjunction with the medical faculty of University of Papua New Guinea. And WHO is providing short-term training for laboratory technicians. The testing program is expected to be up and running in the first quarter of 2013. The Pharmaceutical Advisory Committee has been reformed in the National Department of Health to take oversight of the contents of the essential medicines list, including the suitability and quality of therapeutics used in the Papua New Guinea health systems. And there is a medicines quality project, a project that asks the question, is there an acceptable quality of general antibiotics in the Western Pacific region? The pilot study is being conducted under the auspices of WHO and several Australian universities. It covers PNG, Vanuatu, Solomon Islands, Australia, East Timor, and is looking at a range of general antibiotics, injectables and oral, to measure the effectiveness of quality assurance systems for medicines in these countries. This will be a useful benchmark for the ongoing quality assurance program in Papua New Guinea. Pharmacovigilance program to monitor adverse drug effects and thereby enhance patient care and safety is one of those important points. Quality assurance in area medical stores where our drugs are stored, procurement and quality standards, and system supports are being looked at to enable this to happen. And so, in a nutshell, there's procurement of medicines called for through public tender and quotations. Then there is the technical evaluation of medicines quality by technical evaluators. These are specialists who know their stuff, and they get to look at these medicines and say yes or no, and upon that then it goes up to the procurement of or through the tendering process.
There are two key factors. One is like failure to transparently procure all medical supplies from quality assured suppliers. And another factor is also ineffective medicine quality regulation and the enforcement of legislations. like I mentioned, that it's a government's responsibility to really make sure they follow proper procedures to bring quality assured medicines. But I mean, even the studies conducted by UPNG and 2011 studies in reputable magazines, it's confirming that most of the medicines circulated within PNG are substandard, and if not like counterfeit medicines, and not even fit to consumption. It's also counterfeit medicines freely available in the open markets, and if you go to provinces and especially in the trade shops, you can buy any medicines you like you can buy amoxicillin, you can buy any Thymitis, all directly imported from China. And even very reputable pharmacies, like they are bringing a lot of medicines from Asian countries like China, India, and nowadays those medicines are having certain ingredients or components which are totally banned in developed countries.
And that's a very serious allegation.
Yeah, and it is proven, and it has scientific evidence. I mean, there is an article which is written in international German laboratory which has tested all these medicines from Papua New Guinea, that it doesn't really meet any quality standards. If not, like they have that same chemical name and everything, but mostly it's all consists of inert materials. So far the reality is we do not have that facility to test any medicines which are available in the country. So in the event that if we have no facilities to test all those medicines, then it's an obvious fact that we have to follow certain standard where we can procure medicines from quality assured medical suppliers, or the suppliers who are internationally recognized for quality and who meet those WHO's, they are complying with WHO requirements.
There's been a lot of work that's done and that's ongoing to enable us to get to address many of the issues. But these issues are long-standing. It's not something that can be done overnight. It needs processes for us to work on and build. And as I highlighted in the statement that I made earlier, that some of the challenges are capacity issues that we face. How we get the right people to do the right thing. We know what we want to do. We know where we have access to get the best support, either with the challenges that are brought in, like what has been mentioned about the WHO certifying drugs. We are doing that and enabling this to happen, but there are many areas still yet to be done.
Yes, good, thank you.
We have instances where we have counterfeit medicines coming into the country, and this adds to problems like disease resistance to treatment. We believe that we are getting the right medicine when we do go to the doctor, but at times now you're not too sure.
As a music, na mixing marasin does marasin aim no work inside of body blooming.
Well, basically, if you have independent checking which can be done on medications, you do have facilities in country that can do that sort of thing. And it's not a difficult thing to do, just as long as it's made part of the process of Department of Health procurement and management of medicines that are coming into the country and being distributed.
PNG has a post-colonial legacy of expecting that government has to do everything. And I would pose to you, from looking at other countries, that certainly government has to set policy, government has to set standards, government has to regulate, government has to deal with quality of drugs. But government itself does not have to ensure that does not itself have to supply the drugs out to the population. There are many different models. There are few centrally managed systems like Papua New Guinea left in the world. They're mainly in the former Soviet republics. Other systems are much more mixed. You go to somewhere like the US where it's virtually fully private. 70% of Asian health systems are largely provided through the private sector. There aren't a lot of countries that actually think everyone should get their medicines free and have it delivered to them by the government. So the question that I think we have to discuss here is what are the sorts of models where you've got an effective procurement and an efficient procurement of quality medicines that actually get to the people where they need them. Because why are people selling amoxicillin on the streets? Because no one gets them. The private sector is not huge here, but the pharmacies are springing up all around the country. So you can work with private pharmacies to get quality assured, reasonably priced drugs to the people. But I think this issue of giving drugs to everyone for free is something that the government's got to consider, and the government's got to consider that its role, it doesn't have to be every bit of the supply chain, and maybe Coca-Cola or someone else is going to do it better.
Our emphasis is to train the necessary workforce to assure quality of medicine. We cannot achieve or we cannot implement anything seriously if we don't have well-trained pharmacists with the holistic skills to ensure maybe children medicines are safe and of quality, highest quality. You will notice that the issue of what triggered the 2011 study, which I understand was published in the Journal of American Pharmaceutical Sciences of the United States. That started from the School of Pharmacy in UPNG, when the students, through research, they picked up from global market amoxicillin, sold with sugar, sold with salt and everything else. Therefore, we came back and said, look, what are we doing there? We have to start inculcating the skills to students to fight what they consider at that time counterfeit medicine. Of course, those samples we were found were counterfeit according to WHO's definition. We also look at training. We look at training pharmacists or graduates holistically with all skills to manage, to ensure quality distribution and quality storage and usage of important medicines such as vaccines. This is a very difficult area to talk about, because when we have vaccines here, or maybe a million or maybe less than 500,000 children vaccinated, if the vaccines are not working, then those children are not immunized, and it's very difficult to prove that. Given the fact that we don't have fully equipped laboratories to undertake testing of samples, which may be an aspect which can deter the people who may be thinking about distributing substandard medicines. We need to emphasize, for the time being, building in quality in the purchase system. Has been said earlier on by the Deputy Secretary, such that the medicines which come in are medicines which have reasonable quality.
The last question government needs to address is affordability, because you cannot keep supplying all of the medicines to everyone for free. You've got non-communicable diseases coming up here that are very, very expensive and long-term to treat. So the government's got to address this issue of affordability and ability to pay.
Number 7, the point that has been highlighted by some of the speakers about collaboration with other stakeholders. Yes, we are doing that. We've had engagement with many of our stakeholders, like the Royal Constabulary, PNG Customs, Internal Revenue Commission, PNG Ports, National Agriculture Quarantine Inspection Authority, National Standards Office. So that's been done, and with some of them we've had an MOU signed so that this didn't happen.
I think that the procurement process is kept within the country, and I think it needs to be opened up so that we have international tendering. There are already established quality assured companies who are out there, and so there's a sense that we need to free up a bit, I think, in an immediate time. We respect what the work that the health department is doing, but I think in the immediate, we need to look at the drugs that we are bringing in. Are these drugs quality assured? And I think international tendering perhaps provides an opportunity for us to actually get the companies who are assured to be able to actually bring in drugs.
There are a few suggestions which I mentioned, like the immediate thing is we work towards establishing that independent health procurement authority, which was our commitment to Australian government. That was even reinstated during the 2012 that both ministerial meeting, and also that we improve our information system to capture the actual usages. And we should put a system which can centralize in Mosby, and also it links to all the general hospitals in the provinces, which can give them the actual usage and information on the usage of medicines, and so that we can budget based on the actual usages. And also we strengthen all our area medical stores in terms of their capacity, improve the conditions where they store all medicines. Like those complaints about there is no proper generators and proper facilities to store medicine has to be addressed, because we are still within that capacity to address those issues.
The Department of Health has the primary responsibility of educating the community and depriving the illegal suppliers of the market. There have been persistent reports in the past about antiretroviral drugs perishing on the wharves due to delay in clearing the cargo. Perhaps the failure of the Department of Health to ensure timely distribution of drugs has created a window of opportunity for fake drugs to get a foothold in the community.
PNG is one of the last countries in the world where the government is endeavouring to supply pharmaceuticals. Would the department consider outsourcing pharmaceutical supply?
The Attorney Generals, we are doing an audit on church health services. Health services provided by the church, and one of the things that we found out is lack of medical supplies in some of the facilities. And is about the delivery of these medical supplies. I understand that the Department of Health has engaged LZ Logistics, which delivers these medical supplies. But we found out that most facilities do not have access to these medical services. So I'd like to ask the National Department of Health, how effective is your system of delivery of these medical services?
Those are very difficult questions, and this is the reason why we have a new national health plan. And in the new national health plan, we are approaching issues that affect us. This new national health plan has one of the key result areas of health system strengthening. Health systems have been challenging, they've broken down, and we are working towards building those up to enable us to deal with issues such as what you highlight. We have partners who have been contributing and helping us to enable us to support us as we build our systems. And Jose ought to be commended in the support that's given us with the 100% kit distribution. And of course, you mentioned about LD logistics, and it has challenges. But the key point is that there is that desire, and we have within our national health plan to build our systems. And at the end of the day, one of the questions that was asked, what would be your concluding remarks? My desire is to see Papua New Guineans take ownership and build, those who take on the desire to do what is the right thing and make sure they do the things that are right. And at the end of it all, we are able to deliver what needs to happen.
And that's all we have time for on Olsem Wanem. We would like to take this opportunity to thank Osaid and all the panel experts and those of you who were involved in the discussion. Until then, if you have any comments, please send them to the address on your screen. But for now, enjoy the rest of your viewing here on MTV.